One of the things, and I could probably spend an hour here into some real deep research and things that I'm doing, but you whatever business that you are in healthcare, if you're a pediatric specialty or you're a federally qualified health center, ambulatory surgery center, how well does your current business processes and services fit into the foreseeable future of healthcare? I don't mean 10 years from now. I mean in 26 and 27. Having a real good idea of what may change doesn't mean it will, but how do your current processes fit if things do change to your detriment or to your benefit? And there's been a shift. I looked at some research done by Deloitte on we often look at change by cutting. There may be recession, there may be increased costs, etc., and we get the scissors out. But executives, according to Deloitte, says there is a trend that is, I think, fairly positive, is that looking beyond cost savings alone, not just cutting, but how to improve the patient experience and increase demand by focusing on strategic growth, improving and expanding your revenue capture, decreasing that input administrative cost we talked about earlier, and then optimizing your capital investments over the next few years. There's a lot to do: IT modernization, cybersecurity, but there's also new age technology, virtual care, remote patient monitoring. These topics here is something I'm going to talk about the upcoming National Association of Community Health Centers conference with McKesson and with a couple of other guests. Talk about what those are and how can it help not only your patients, but your bottom line. And as we look at this, we're not just talking about telehealth. We're looking at virtual health. And one of the things in the report I looked at is this increasing trend of consumers. We call them patients, residents, whatever your type of organization is. But, that initial visit, consumers are returning for virtual health. And again, not just telehealth. And as we look at this from 2020, about 80% in 2022, 84%, and this last year, 94%. And if you look at the generations that are embracing virtual health, the millennials certainly leading the way, followed by Gen Z and Gen X. I think the baby boomers here are a little underrepresented because myself, I think there's a great demand for that. But as you put all this together, looking ahead, waiting for what rules are going to change, waiting for funding changes, take a look at your business and see, do your processes, are you agile enough to make the kind of changes to maximize the benefit of those things that are going to happen or not happen, right? I'll give you a personal example. I just started getting some acupuncture and it really worked well, and some changes to the healthcare payer, because after 5 visits, they'll give you a few more, but if it's not making it better, in other words, creating a cure, then they're going to discontinue doing that. And the acupuncturist that I saw had a real big impact on his business. He said, look, the difference between the payment and the co-payment is not that big. You pay me the co-payment, I want to keep you as a customer. And that's a very small example to some very big problems that can happen, but we're going to have to get creative, and we're going to have to look at some shared cost and some ways in which to keep our patients coming back because of the excellent services and outcomes that you're getting. So again, looking at the foreseeable future, keep in mind what you may have to do, what you could do, and what you should do by being